Hi there, and welcome to How to Control the Spread of Microbes. Healthcare workers take certain actions to control the spread of microbes that can cause disease. This practice is called infection control. Protecting those in your care from infections is an important part of providing quality care. You probably already practice some types of infection control in your daily life without even thinking about it. If you cough or sneeze, for example, do you cover your mouth with a tissue or cough or sneeze into your elbow to control the spread of germs? If someone you know has a cold or the flu, do you try to keep your distance from that person so you will not catch the cold or flu yourself? Do you always wash your hands after using the bathroom? If you do these things, you are already using infection control methods. 4 common methods of infection control used in healthcare settings are pictured here, and they include hand hygiene, which does include hand washing with soap and water or the use of an alcohol-based hand sanitizer, decontaminating objects and surfaces, using personal protective equipment, and taking isolation precautions. Hand hygiene is an important part of everyday life, especially in your role as a nurse assistant. And it is one of the most important things you can do to control the spread of microbes. You should wash your hands whenever they are visibly soiled with dirt, but also when they come in contact with blood or body fluids. And those are all listed here to your left. Urine, feces, saliva, mucus, vomit, semen, vaginal secretions, breast milk, and wound drainage are all examples of blood or body fluids that you should use hand hygiene before and after coming in contact with. Other times would be before and after contact in general with those in your care, before and after putting on your gloves, after coughing, sneezing, blowing your nose, after handling dirty supplies or equipment, before eating or handling food, before cleaning supplies or equipment, and most definitely before going home, and really anytime you think it may be important. So let's talk about some do's and don'ts about hand washing. Do keep your fingernails trimmed short and use a nail brush or an orange stick to remove dirt and microbes from underneath them. Do push your watch above your wrist or put it in your pocket or pin it to your uniform. This enables you to wash your wrists along with your hands. Do apply hand lotion to prevent the chapping and dryness that can occur with frequent hand washing. Don't wear artificial nails or nail polish. Microbes can be very difficult to remove from the spaces created when artificial nails lift up or nail polish peels and cracks. Don't wear rings to work. The tiny spaces in jewelry are difficult to clean and can harbor microbes. In addition, it's difficult to remove microbes from underneath the jewelry. When you work in any healthcare setting, you can help control the spread of infection if you understand what exactly is meant by clean and what is meant by dirty. Clean items or surfaces are considered to be free of dirt and pathogens. An unused item is considered clean until it comes in contact with a person or his environment. It is considered dirty and cannot be reused for another person. Dirty items or surfaces are considered to be contaminated because they contain dirt or pathogens. These can be linens, dishes, clothing, bathrooms, doorknobs, countertops, and all high-touch surface areas. So let's talk about some general actions that you can take to help control the spread of microbes. Obviously, cleaning your hands frequently, using soap and water and alcohol-based hand sanitizer is absolutely necessary. Taking care of your body. Eat well, exercise, get enough rest, keep your immune system healthy. Get vaccinated. Vaccines are available to prevent many infectious diseases, including the flu, hepatitis B, and receiving appropriate vaccinations and keeping them up to date helps protect you from getting these diseases. Stay at home if you're sick. As you've learned to recognize the signs and symptoms of infection, recognize those as you work and report those to any nursing personnel. Maintain your own cleanliness. Keep yourself and those in your care and the environment clean. Ensure single-use personal protective equipment. Handle linens appropriately. When you handle bed linens, be sure to keep those dirty linens away from the uniform. Avoid shaking dirty linens because this can spread microbes into the environment. Place the dirty linens in a laundry bag in the person's room before you carry that bag to the laundry hamper outside of the room. And always place any wet or soiled linens in a plastic or leak-proof laundry bag. Be sure to cover bedpans and urinals. And moving on to food, you have to be sure you prepare food carefully. Wash your hands first. Rinse off the tops of cans before opening them. Wash fruits and vegetables. Ensure cooked foods meet the proper temperature. Wash cutting boards, especially when you're preparing meat and poultry, with hot soapy water, and use separate cutting boards for cutting meat or poultry and vegetables. Always serve meals immediately after food arrives, maybe from dietary or delivery. And just be sure to store foods carefully, maintaining the recommendations on refrigeration. So those are just a couple general actions that can help you control the spread of microbes. So on to what's next. How to safely put on PPE.